Thank you guys so much for coming. My name is Donna Suleimanova. I'm the events coordinator here at the Mooter, and we have Jasmine Brown and Dr. Jackson here. Just some short bios and we'll get into the book. Jasmine Brown is a medical student at 10 and completed her master's in philosophy in the history of science, medicine, and technology at the University of Oxford on a Rhodes Scholarship. As an undergrad at Washington University in St. Louis, she founded the Minority Association of Rising Scientists and served as the president, working to increase the number of underrepresented minorities in science and medicine. And then Dr. Jackson is a College of Physicians Fellow here at the Mooter. Is a double board certified adult, child, adolescent psychiatrist, public health practitioner, and lifelong learner. She is the CEO and founder of Palawa International Consultants, a full-service, direct service practice delivering individual and system-level care and consultation. And we're just super happy to have both of you here to talk about the book. This is your first novel, right? Debut novel. So exciting stuff, so I'll let y'all get into it. Thank you.
Thank you, Donna. Thank you, College of Physicians, for having this event. I have to say I'm in awe and I was very intimidated about being here today because I thought, when on earth does this woman find time to write a book? I didn't know this book. So she's going to tell us a little bit more about that. But I think this is such an enormous opportunity to learn from stories. I'm a psychiatrist, so that's how I do my work, is through personal narratives of folks and their triumphs and challenges as well. And so I'm really honored that Jasmine took on the task of bringing these stories to life of these women who have been untold throughout my entire medical education. You know, for physicians in the room, I'm sure it's the same. And I think there are lots of parallels in many other fields of professions and careers as well. So really hoping that you guys all are seeing some of your own stories and pathways in this work. But first, let's get into it. So how did you get to write a book as a medical student? Jasmine, you can take us on that narrative.
Yeah, so first I want to say thank you all for having me. It's such an honor. So I guess the journey started in undergrad. I was really active in research and I had personal experiences with bias in the lab and realized that I had many friends across the country who were Black and Latinx who had similar challenges. And I started MARS, Minority Association of Rising Scientists, with an effort to increase diversity, to counter the implicit bias and imposter syndrome that people were experiencing, and it was really fulfilling for me. So then I got the Rhodes Scholarship, and I was trying to decide what I wanted to study at Oxford, because the scholarship defined studies there. Initially, I was thinking of a DPhil in neuroscience, which is what I did in undergrad, but I really loved this work that I was getting into, and I found out that there was a history of medicine program. So that seemed like a great fit to look at the historical roots to better understand some of the challenges that I was seeing in present day. And I decided to focus on the experiences of Black female physicians because at that time, I was leaning more towards medicine as opposed to research. And when I was looking in the literature, I realized that there's limited literature looking at the intersection of physicians who were both Black and a woman. And since that's what I am, it felt like a good project to pursue. It was really inspiring, eye-opening. Before that point, I had never met a Black woman physician. And so to learn about these women, some of whom were entering medicine 150 years ago, and to be able to meet on my own and to learn more about their stories, it gave me motivation for my own journey, and I wanted to share that more broadly. So that's why I decided to write the book with that aim of making these role models more visible and making their stories more well known.
Tell us how easy or challenging it was to find them. curious about the process there.
It was difficult because there wasn't much literature to go off on. So when I was first started off on the research, looked at other articles with similar topics, but a lot of times it was either Black men in medicine, white women in medicine, or Black women as patients. And so it was difficult to look at these articles and say oh, what resource do I go to? But they gave me a good foundation on what was generally happening, particularly in the late 19th century and turn of the 20th century. And because I didn't know about Black women physicians by name, I didn't know who to research. But over a couple of months, I started to find people. I had some research mentors who advised me to go to different sources, archives, and libraries. And I stumbled upon the Black Women Oral History Project, which is part of Radcliffe College. And they had a few Black women physicians in that archive for special collections of Black women. And that was really amazing. So the first woman I learned about was Dr. May Chen, who was born at the turn of the 20th century. And they did this oral history, which they're interviewing her about the course of her life. And I'm just listening, sitting in my dorm room and listening to her voice. And it felt like she was speaking to me, telling me about her journey. And there were things that resonated with me, but also just seeing her overcome various challenges and still be so successful was really inspirational. It was like a breadcrumb, following the breadcrumbs. So I found this woman, maybe that'll lead me to the next.
Were you surprised? I mean, I'll tell you, I'm surprised I have a bias. Probably shouldn't say it, that in when were you doing this?
2018 is what I
Right.
said.
2018, that it was so difficult to find these women.
Yeah, I guess because when people think about the big titles of who was the first Black physician, who was the first woman physician, then there's this thought we're covering these people with different backgrounds. But because, especially when there was the first Black physician, first female physician, which was in the early and mid 1800s, there were such huge barriers individually from a race basis and from a gender basis to enter this field, and so that made it even harder for Black women to enter this space. So I think once they entered, they weren't seen as trailblazers in the same way, and so their stories weren't documented as heavily.
So you hinting at intersectionality here, and I really like the way you bring it up very early in the process, especially when you start talking about the first Black male physician, which predated the first white female physician, interestingly. But then the numbers sort of got away, right?
Yeah.
Can you talk about that a little bit, what you learned in terms of the first?
Yeah, so the first Black physician was Dr. James McCune Smith. I think he was born in 1813. He was initially a slave in New York, but then slavery was ended there. They had state-specific Emancipation Proclamation. So then he entered this school for Black boys, started learning, and then at that point he decided he wanted to become a physician. I don't remember what year, maybe it was 1830s or 1840s when he was pursuing medicine, but every medical school in the US he applied to denied him because it said we won't accept anyone who's Black. So then he applied to medical schools abroad, and he actually went to college and medical school at the University of Edinburgh. And kind of what you mentioned of that gender versus race dynamic, it was really interesting to me to find out that in Edinburgh and many other places in the UK, they, at that point in the early 1800s, were willing to accept Black men, but they would not train and teach women regardless of their ethnicity. And it wasn't until, I think like the 1960s, where they were like willing to officially train women, put them in their colleges, etc. So that was Dr. McCune Smith, and then a decade or two later, Elizabeth Blackwell was the first white female physician that trained in the US. She was actually born and grew up partially in the UK, but then she moved to the US. And when she was applying to medical schools, she was also rejected, like people laughed at her. And she applied multiple rounds, and eventually there was a school, I forget what school it was, but I think one of her like mentors or supporters, a male physician, had some connection to the school. So the dean said that he wouldn't reject her outright. He would let the men in the class vote. And if only one man voted against, then she would not be allowed in. But the guys in the class thought it was like a funny joke. And so they accepted her. Like they thought it was ridiculous that a woman would try to pursue medicine. Like at that time, this ideas of what is a proper woman, not someone who would want to look at the naked body, not someone who would want to pursue a profession. She's someone who wants to have kids and get married. And that was something even her mentors told her. And they initially said, like, you can maybe try dressing up as a man and just get the education, but like not get the degree. That's something that women previously had done, but she wanted to get her degree and not have to dress as a man to do it. So on the premise of a joke, she ended up getting in. And then the first Black man to get a medical degree in the US was a few years after her. And similarly, they allowed the students to vote to see if he should get accepted. And they also thought it was a joke, or some of them were against it. And for him, it wasn't like just one person, it was majority. So some people were like, we don't want this person in our class. And at that time, I believe in the 1850s was when he started medical school, and slavery was still legal nationally. So like some of his classmates could also have, their families could own slaves, and they're like, this person is not on our level. So there were some people who voted against him, but the majority voted for him. So then he was allowed to enter medical school and graduate. His name is David Peck. So yeah, so those are some of the early trailblazers. And then the first Black female physician was Dr. Lee Crumpler. She started medical school in 1860 at New England Female Medical College in Boston. And she's actually the only Black woman to graduate from that medical school. And so for her, she had a circuitous route. Initially, she worked as a nurse, but then ended up pursuing medicine. And when Abraham Lincoln was elected president, people started to worry that he would end slavery. And from my research, it was actually that he wanted to just prevent its expansion to the West, but that's what set off the Civil War. And in Boston, there were a lot of people that were against the ending of slavery, and so there's a lot of violence in that area towards Black communities. And even like describing instances where like white Bostonians were going into Black neighborhoods, like breaking into people's homes and beating them on the train, and the police just standing by and watching. And this was like 2 miles away from her medical school. I don't know if she knew anyone personally that was harmed in those, I don't know what to call it, like acts of terrorism. But she stopped medical school at that point went to Virginia, which she felt was safer at that time, and then didn't return until after the Civil War, after the Emancipation Proclamation was signed. And she graduated 14 months after in 1864. And so with that, it's like she had to go to a female medical college because many women weren't accepted in these male medical colleges. And then she was the only Black woman there because many Black people were not accepted in these spaces. And so just seeing that intersectionality and the barriers that were in her way, in her journey.
I was having this thought when reading about her story, just thinking about going through medical school and not knowing if you could be potentially enslaved during your training before you ended up being a physician. How crazy is that? I mean, we have a lot of challenges now, but that's not one of them. And it was just so compelling reading her story. And Jasmine in the book talks about being in her cramped little dorm room and at Oxford, reading these stories, and I could just imagine turning pages, like really eating up the inspiration, really, that was coming through from the resilience.
Yeah, it was really meaningful for me to actually learn the stories of individual Black women physicians, because initially I went in trying to understand the social and structural barriers that have prevented us from entering medicine. But when I was doing that, it was actually really discouraging to realize how far back that history went and even how it spread on a global scale. Like I was seeing some similar tactics for oppression used in South Africa that were used here. And so just seeing how prevalent it was, that oppression was like, okay, can I get through this? But then once I was actually able to find specific women and learn about their journey, seeing that, yes, they also experienced barriers, but they still were able to overcome, was really motivational for me.
Tell us a little bit about what you learned about the structural barriers, that initial question that you had. What did you find, and can you comment on where we are now?
Yeah, so there were some very explicit, like, we will not accept Black person, we will not accept a woman. And that slowly went away at different levels of the training. So initially it was, we will not accept these people in medical school. Then, okay, we'll accept them in medical school, but we won't accept them in residency. One of the women, I'm blanking on her name right now, but she had to apply to residency 8 times in a row before she was accepted, despite working, like finishing medical school and then working at the hospital that she was applying to. And when she continued to be rejected, she asked her, like, why won't you accept me to your residency program? And they said, you have 2 handicaps, you're a woman, and worse, you're Black. And so seeing that level, like at each stage, not being allowed to continue their training to be the best physician that they could be. And then there were some more hidden structural barriers, such as the Flex Report of 1910, which Abraham Flexner was trained as a teacher. He didn't have medical training, but his brother was an accomplished physician, and Abraham was like looking for a job, and so his brother recommended him for this position. And so basically, this was at a time in 1910, at the turn of the 20th century, medicine was undergoing huge changes. There was the discovery of microbes like bacteria and how they could lead to infection. There was the development of new specialties such as like different surgical specialties, especially as anesthesia became more integrated into surgery. And so as science basically became more prevalent, then it affected how medicine was practiced. So what I would call biomedicine now, like research-informed clinical approaches. And So the AMA and then like the Rockefeller Institute paired up, like advocating for this evaluation to see if the medical schools were using like research-informed practices. And for the practicing physicians who encompass the AMA, for them it was more because like there was more and more people entering medicine, and that meant fewer patients per physician, which leads to a lower salary. The American Medical Association, which is the like association for, currently it's all physicians. At that time, they didn't accept Black physicians and were like stringent on, they would allow like women physicians within their society, but they had a lot of influence. So Abraham Flexner went around to every medical school in the country and evaluated them to see if they felt like they were up to par. And he recommended the closing of all women's medical schools, saying like they need to integrate into the male medical schools, and then recommended the closing of all but 2 Black medical schools. And in terms of the Black medical school physicians, he said that like Black physicians should only be treating Black patients, and if you were Black doctors, the better. And that policy change, or another anecdote of that like shift that was made in terms of his evaluation of schools that showed me that there was flaws to it, was one of the schools that he had recommended closing, in addition to some of these others, was Washington University, which is my alma mater. And WashU said, "Oh, come take a second look," and gave him some money. And then he said, "Okay, actually, I think they're up to par." And it's really funny because WashU is like one of the most like respected medical schools in the country now. So it just shows like there was flaws in his decision making on what schools should stay open and what schools should close, and obvious bias in his decision to close these medical schools dedicated to training Black physicians and women physicians. So at that point, the number or like percentage of Black physicians was continuously rising. But then after the Flex report in 1910, so at 1910 it was like 2.5% of all physicians were Black. And then I think in 2006, almost 100 years later, it was like 2.3%. And so that one policy shift that then created this bottleneck for access to medical education had century-plus long impact on who was able to enter medicine. And so if he hadn't created that, there likely would have been many more Black physicians and many more women entering medicine. And then for the Black women physicians, because there's some of the women in the book that talk about would seem to be a quota, like a reverse quota, and we will only allow this many people to enter our school. Dr. Farabee spoke about that at her school. She went to Tufts. This was in the 1920s. And there were 5 women in her class of over 100 students. She was the only Black woman. And she was saying that it seemed like they had a quota of only allowing a few women in their school to allow for that, like the loss of the women's medical colleges. But in that space, they almost exclusively accepted Black women. So there weren't, she was the first Black woman at Tufts, but just generally, like there weren't as many able to go into those schools. And then for the Black medical schools, still going with the views of the time of women are supposed to be the homemakers, men are the ones that are earning the like money for the family, then Black men were oftentimes like preference over Black women in those spaces as well. So then there were fewer places for Black women to go to train.
What do you think of now?
Oh, yeah.
The structural challenges.
So the impact of the Flex report still persists. Like there are now 4 Black medical schools. So initially it was Howard and Meharry. Now added on is Morehouse and Charles Drew. There's definitely more white women entering medicine now. I think it's approximately half women overall. But there's still a significant underrepresentation of Black physicians in general. Less than 6% of all physicians are Black. There are more Black women entering medicine now than Black men, which we may touch on later, of like some other changes in society that put pressures on the Black men that were able to enter medicine and other professions. But maybe it's around 3% that are Black women. So still these levels of oppression and barriers that prevent access. And I think other barriers like financially, I was shocked when I was going through the med school process to realize how expensive, the medical school application process, to realize how expensive it was. Like people having to spend like upwards of $10,000 to apply. And then that doesn't even consider like how much tuition is, how much all the little things are within medical school. That can be a significant barrier. And then I also seen in my own school, but learned that more broadly, this like idea of nepotism or legacy, where there's a lot of, we call it hidden curriculum, like untold ways that you need to like navigate medicine and medical training. And so if you have family or close friends who know, they can teach you how to navigate, but if you don't, then might be walking blind and are more likely to stumble. In my school, the majority of my class has a parent or sibling who's a doctor. We were randomly assigned learning teams our first year, and which is a group of people who like go through problem sets together during the classroom segment of medical school. And in my learning team, there are 6 of us, and I was the only person who didn't have a parent or sibling who was a doctor. And that's something that's just been shown nationally, like more than half of all medical students have a family member who is a doctor. And so that also, I think, speaks to issues with access to the profession and how having that insider knowledge can help people to advance within the space.
I was sharing a story with Jasmine as well. So I went to medical. I just had my 20th reunion, so a little earlier. But I remember when I started my 3rd-year rotations, the attendings would ask, "So which one of your parents is a doctor?" So my mom's in the audience. She's smarter than most doctors I met, but however, she's not a physician. And I felt like it was a repetitive sort of like insult every rotation I went through during my 3rd year of going through that. I happened to go to a school as well where during our white coat ceremony in the beginning of your first year, which is where you get say your Hippocratic oath in front of your family and your white coat is donned. The faculty were allowed to don white coats on their children in our class. And that's when I learned after a week of hanging out with everybody that it was somewhere around 25% of my class had parents on faculty that would teach us. It's very easy usually with the dad, so the last name of the neurology attending was the guy in my class. But it does something to you in terms of feeling like you belong. And so I'm excited that I didn't have your book, but I was saying I just came from a fellowship I did where I, for the first time, did not feel like I emailed Jasmine today like a crazy unicorn because this fellowship was all around equity and it met people who were like me for the first time. It just happened to be at the end of all of my clinical training. that one of the alums there, she's on faculty at UMass Medical School, and I had my book out, and I said, you should get this for all the first years. Because I think it's so powerful to feel connections, especially for folks who don't usually have that opportunity, and to learn that you're not the first, right? And that others have done it. For another plug for the book, when you read about Dr. McCune, I was just thinking about the fact that there was no internet. There was telephone. This man found his way from New York to how do you do that?
I don't know, but I thought about that because prior to going to Oxford for graduate school, I had thought about college abroad. I think I just had this interest in experiencing something new, going beyond what I was used to. And so I had looked at different schools abroad, and I had actually looked at Oxford. I remember like reading about whether it be like how to apply or like what the experience is like, and getting a headache because I was so confused. Like it wasn't majors, it was courses, and it was different. And that was something that I actually wondered about his experience as well. And was like in awe that he was able to navigate figuring out how to apply to a school abroad and
Without the internet.
yeah, and then navigate that space, like getting on a ship. I don't think his parents were with him, and just like, okay, I'm here, new country, new culture.
I'm just wondering, I'm just looking a little bit at time. I wanted to have some audience questions for the last 15 or 20 minutes, but one question is just in terms of what you want people to take away from the book. Both people who are underrepresented minorities in medicine, like yourself, like Black, either pre-med or medical students who are women of color, but then also your classmates, for example. So people who are the legacies, right? What do you want them to take away from that?
Yeah, I had two big goals with publishing the book. The first one was to show these stories. Like, so for me, growing up, I had my classmates or other people telling me like, I won't do well in school because I'm Black, and Black people aren't smart, all these things. And while my parents aren't doctors, like I looked up to them, and so they were who I tried to focus on and to block out that negative messaging. But I know a lot of people don't have that privilege, and so I really wanted to make these stories more accessible so that young people who may be told that they can't succeed in whatever space because of some identity will have this inspiration and these role models to look up to and inspire them to push towards their dreams. But then on the other hand, I also wanted to reach people who are allies, who are passionate about advocacy in this space, even if they don't share these identities, who can see like, okay, these are some of the historical roots that have led to what we're experiencing now. Let's take a more targeted approach to addressing them, such as, okay, like HBCUs, historically Black colleges, like played a really important role in diversifying medicine and still does, even though only 4 medical schools are predominantly Black, they still train over half of all Black physicians. And I think it's easy for those like HBCUs to brush them off and focus more on, oh, the IB is so important and all of this, but recognizing that these are the institutions that are playing a really important role in training this community. And so if we say we want more diversity in the space, then we need to invest and support these institutions as well. And that's one example of, okay, we see this historical issue, what can we do now to address it? So I think the young people, to inspire them, and for other people who are allies and advocates to energize them that this is still an issue and there's different directions we can take to make things better.
Yeah, I think to your point of allies, I was thinking about Dr. McCune again, going to Scotland, and they didn't allow him, but they allowed him and they educated him. And it sounds like when he got back to New York, he established the first Black pharmacy, and his medicine was more advanced. So his white colleagues were looking to him for education, which I I think it's a perfect example of how equity can elevate everyone. So making sure that we bring more diverse perspectives to the workforce actually can elevate the care that we can provide to everyone. So everyone has a role in that, right? It's not just a black or white or male or female or the intersections of those. And think about LGBTQ colleagues, all these perspectives really will help us really amplify our workforce to address some of the very significant challenges we have that we haven't figured out as yet. So thank you so much for your contribution to that. I cannot believe it was 100+ years coming, right? But thanks for taking it on. We're going to open it up to questions from the audience.
You guys have a question? Just let me know.
Hi, thank you for talking about this wonderful book. Could we go a little bit more into that, like in terms of just like why is this important? It's not in terms of just like what the difference having Black physicians really makes on just like the landscape of healthcare and helping individuals. So if you could dive into that, or maybe some of your experience as a med student so far now. Yeah.
There's been a lot of research that shows that concordant identities or shared identities between the physician and the patient can improve outcomes. So I've seen that in Black communities where, okay, if we understand the culture, if we understand what's going on in the environment, we may be able to better understand some of the challenges. So we were talking about before, like food deserts. If you've never lived in that community or a community like it, you may not realize that the reason why this person isn't eating healthy food isn't because they don't want to listen to you, it's because they don't have access to it. Language barrier, you give them medication, you write it down, they might really want to follow that, but they can't understand all that you're saying. And so just the importance of physicians with diverse backgrounds in order to care for a patient population that is diverse. And without that, how health disparities persist even with the most well-intentioned doctor. You just don't understand why there is this barrier here.
There are even other examples of how Black physicians will work in different settings, right? So you guys are in Camden. If you train up BIPOC physicians from Camden, they're more likely to come back to their community, stay in their community, than majority physicians who may go to different areas, be drawn to different. There's a certain cultural connection that then that's just macro level, but in the room also plays out with the patients in terms of the IOM Institute of Medicine did a landmark study called Unequal Treatment, where they really dug deep into the research around this, showing that if there's agreement of race between patient and physician, something happens in that encounter, and the outcomes, like the hard data in terms of objective outcomes, follows suit with that. It's not to say that you always have to have that 100% match, but to the extent that you can, like right now, less than 6% of the workforce, or about 13% of the population, there's a really clear difference of inequity there in terms of just the opportunities that patients of color have to see someone like that. I'm in mental health, and Dr. Shane goes behind me. I can tell you some different things happen in the room. As a medical student, I was being told all manner of things that attending wasn't. Yeah. And I would say, please tell my attending. They'd say, I don't know her, I don't like her. And it was an uncomfortable space to be in as a medical student, because I knew the least on the team, but just, culturally, racially, the patient just connected to me. And sometimes that wasn't always just with Black patients. I think they just saw me as different than the men on the team. So I rotated with a group of, there was one Black man, who's still one of my lifelong friends, and then 12 white men. And so when I went into a room with a woman, it was very different than when my classmates did. So there are other ways that it plays out as well.
And I think also trust. medicine is not in a bubble, and we have to acknowledge the racism that continues to persist within our society. Like, I think a lot of people like to say, like, oh, well, Tuskegee happened so long ago, why can't these Black people get over it? But there has been continued instances of mistreatment within the medical system, within the research space towards Black people that persists to this day, even seeing in Philly with COVID, how vaccines were not distributed equitably initially. And so when a Black person experiences this over and over again, whether it be themselves or other people in the community, it's natural to be weary when you're going into a space extremely vulnerable. And I think that trust is so important with a physician-patient relationship. And I also think physicians of color may be more comfortable, more willing to speak on that. Like, I remember on my obstetrics rotation, talking to one of my patients who expressed frustration, a Black woman who expressed frustration in some of the earlier visits that she had, and she had preeclampsia, which is basically she had high blood pressure and some other complications with her pregnancy, and she wasn't told all the risks and what could happen if it wasn't managed well, and then it got to a point where she had to be induced in labor abruptly. She just went for a regular visit, and then we need to induce you right now, and just the distress that caused. And so for me to be able to comfortably speak on yes, there is increased maternal mortality rate for Black women. These are these health disparities that exist, and despite that, I'm here for you, and we'll do our best to care for you. I think any physician can do that, and that could go a long way, despite differences in backgrounds. But when it might be easier, it's easier for me to talk about it because it also affects me. But I think that establishing that trust that's being a patient is one of the most vulnerable times anyone is in their lives. And it's really important to have that, to be able to feel like you're safe in that space and cared for. And so being able to go past the challenges that exist within our society, to be I can literally put my life in your hands, that's a really big ask. So I think that is one of the reasons it's easier to bridge that trust when yeah, this issue happens in society, I'm experiencing too, but we're gonna work together so that to help you as best as we can.
Can you say no just about Tuskegee? So I'm not sure if everyone in the room is aware of Tuskegee. And we have a history of science as an expert with us, so.
So it happened in the mid-1900s. Basically, they were testing penicillin, and Tuskegee was where it happened. They looked at various communities in the South and got a group of Black men who had syphilis, and many of them, even once they established that penicillin was this life-saving treatment, they did not give them that penicillin. So many of them died when they didn't have to, just so that the researchers could see the full outcome of not giving it. I think it speaks to some of the unethical research methods that may be talked about in terms of the Holocaust, for instance. And so seeing that in different ways within the U.S.
And this was meted out by the public health system in the country, and the public health nurses who visit these men to study the natural course of syphilis devolving to neurosyphilis, which is end stage, knowing that penicillin was a cure, and now and it's been remarkable to me that even 10-year-old patients in the inner city know about Tuskegee. This is really oral history that runs deep, and it's clearly not taught in schools. Maybe some schools, but not all schools. But there's still the legacy of that is so deep, as well as many other HeLa cells and all the other things we've come to learn about. So, there was a question.
Yes. Thank you for your work for this discussion. I was curious, kind of dovetailing on the discussion about the legacy, and I remember that experience too. Another white Portland family with these women's stories, were you able to glean whether they had the same effect in their communities or in their family? Being at first, but then you see, a wave come after them, sort of like a pebble in a pond, where they maybe had to do it first, but then you start to see their effect from it.
Yeah, I definitely did. I remember one of the women, I think it was Dr. Lena Edwards. She was the first Black woman physician in her family. But after her, she was actually the one who had the 8 consecutive rejections from the hospital that she worked at. But then after her, I think she had 6 kids or something. At least 2 of them became doctors, and then they had kids. And I believe out of the couple of generations, maybe 2 or 3 since her, at this point there's 16 physicians in her family. Yeah, so that, and then also just the social mobility that happens. One of her kids worked for NASA, I believe. I think when speaking to the socioeconomic barriers that exist within medicine, and even at my school, while there's more than half that are physicians, then 90+% are middle or upper income. Parents have at least 1 degree. And so whether it be the intimidation of how long the training process is, all the expenses that come with that, I don't know fully all the different aspects that have contributed to that legacy phenomenon, but I did see that also with those Black women. So once they were able to have that social mobility, and I think one of the things particularly for Black kids to see this is also possible, for them to dream in this manner. For Dr. Edith Thurby Jones was the first Black person to integrate a medical school in the South. She went to University of Arkansas a little bit before the Brown versus Board of Education Supreme Court case that required integration of schools, the public schools. And she, as a medical student, was on a panel at HBCU college, Philander Smith College, I believe, that was also in Arkansas. And Jocelyn Elders was a student at the time. Jocelyn's family were sharecroppers. She was the first person in her family to go to college, and which just happened because she had good grades and got a scholarship. And so when she got the opportunity to go to college, her career aspirations were to become a Deloitte sales clerk because she thought it would give her more financial stability than working as a sharecropper. Then when she met Edith Thurby Jones, she was so inspired. She said she had never met a Black woman or a physician before, any type of physician. I guess because she lived in a rural area and didn't have access to healthcare. And she's like, it was the most beautiful thing I saw, and I decided I'm going to become a physician too. And then Dr. Jocelyn Elders ended up becoming the first Black Surgeon General in the U.S. And so I feel like that, instance of having a role model or seeing someone that you that you identify with and feel okay, if they did it, I can do that too. Counteracting messages that are so widespread within our society of what Black people are not capable of, it can go a really long way. She had this potential to have this level of impact within medicine, but if she had not met this person when she was in college, she likely would have never pursued that path. And so I think that probably is one of the big factors for probably all kids who have parents who are physicians, but particularly those who come from backgrounds where people tell them they can't succeed in those spaces.
So really the importance of representation, right?
Yeah.
We have one Black president.
Yeah.
That's a very different childhood to grow up in.
Yeah.
The childhood I grew up in. Where do you take this next? Because if you were in your mid-20s, I won't say your age, before you met your first Black woman here in the book, right? Speaking of representation, where do you take these stories and how do you kind of move forward from this really transformative
Yeah, it started off with just being really passionate about sharing these stories. And initially I thought like journal articles, that's what I was used to, but then I had more than I could fit for some articles, so then it's like, okay, I'll write a book. But it has been transformative. It's been so wonderful. I've been in awe of the positive reception, how much support that I've received, and
Including from Shondaland, which is pretty
and,
cool.
and also so touched from like hearing people telling me like how that individually impacted their lives. So I don't know if I'll write another book. Like I actually love the writing process more than I expected. I've always been a creative and I painted a lot when I was younger and actually started off at Wash as a double major in painting and neuroscience, but because of like the art studios and the research labs, like I dropped the art major and just focused on the science part. But this was a really wonderful experience where I felt like I could use that creativity to share this message that I really cared about. So I think now I'm in like the data collecting phase, trying to see how I can integrate this more into my career. I definitely see advocacy as being an integral part of my career. And it's been really awesome being able to tap into my creativity more so than just at home as a hobby. So yeah, I'm trying to figure it out, but I'm really excited about the possibilities, and I'm really glad that I did this project.
Thank you. It's it posted something that I thought it was such a gift that you've given the history of science and history of medicine, and these women, and the all of us. Thank you so much.
We did want to give you a little merch from our gift shop, just as a thank you for sharing this book with us and being here. So thank you very much. Yeah, if you guys don't have the book, we have our gift shop open if you want to go grab a copy. And I think Jasmine is down to sign some and do a little meet and greet. So yeah, thank you guys for coming.
Thank you.